How often were you doing fentanyl?
At first, it was maybe for the first few days, maybe once or twice a day. And then after those few days, every 30 minutes.
How much money were you spending on it?
A little over $1,000 a week.
From affluent neighborhoods in Carlsbad to homeless encampments in Santee.
It's scary. It's really scary. I found one of my friends, just dead in his tent. And that's a lot.
Fentanyl continues to invade the lives of San Diegans in record numbers.
And for people who've never taken this drug, you know, we hear about how strong it is, how powerful it is, the kind of high it gives people. Tell me what it feels like.
Oof. It's like a warm blanket, a security blanket, something that makes you feel safe. Or, you know, when you're really cold and you walk out into the sun and that first ray of sunshine that just hits you, that's what it feels like.
According to San Diego County, over the last 3 years, the number of fentanyl overdose deaths has exploded from 151 in 2019 to 462 in 2020 and close to 800 in 2021, with potentially more cases pending. DEA Special Agent in charge, Shelley Howe.
Why do these deaths keep happening?
Well, I think the demand is there. It's a cheap high. And fentanyl, you know, is the trend. The purity we're seeing is increasing, which is, you know, another extremely scary fact.
The county's new approach is to saturate the streets with naloxone, also known as Narcan, a drug that reverses an overdose. It's giving it to anyone who wants it for free.
Hey. How are you guys? Good, good. How are you? Good. Good, good. We brought you some supplies.
CBS 8 cameras went along with one of the county's homeless outreach teams.
After you guys use it, you're going to need to call medical ambulance, okay? Yes.
As they distributed it near Mast Park.
It's better to have it and not need it than to need it and not have it. And without it, I mean, people are dying.
It does feel like we're literally saving lives with it.
And someone who knows that firsthand.
I went from 1 drink to 5 drinks to 10 drinks to cocaine to meth to fentanyl.
24-year-old Erin Elliott graduated from Carlsbad High. Mom Peggy and Dad Kevin say even though her life may have looked perfect on the outside, their daughter struggled with mental health issues as a teenager and eventually became hooked on drugs.
It was brutal.
Very hard. Very, very hard. The phone calls, the not coming home, the phone calls at 3 in the morning,
exactly.
Come get me. It's a lot of physical and emotional stress.
They didn't know Erin was addicted to fentanyl or that back in September she overdosed and almost died.
The next thing I remember is coming to with a bunch of EMTs standing around me and my friend crying in the corner, screaming like, "You were dead. You were dead. You were blue." My heart stopped. I had no pulse. I didn't have any respirations, and this went on for about 10 minutes.
She says it took 3 rounds of naloxone to bring her back to life.
When you think about that day, had the Narcan not been there, when you think about what could have happened, what goes through your mind?
I would have been another statistic, and I would be another post on somebody's Facebook wall.
She now teaches others how to use naloxone by working with the nonprofit A New Path. She says the county's approach is the right one.
The county just started giving out naloxone at each of its 6 public health centers, including this one right here in El Cajon. All you have to do is show up, they'll give you one of these kits, and you can take it home.
Anybody can administer it. Anybody can actually get access to this medication. And it's really as simple as somebody coming in and saying, "Can I have a kit, please?"
Right now, the county has a stash of nearly 4,000 doses of naloxone, and there are plans to get a lot more. According to county leaders, the medication is provided by the state for free.
The reality is the war on drugs has been an abysmal failure. This notion that you're just going to enforce and arrest your way through dealing with the reality of addiction.
Chair Nathan Fletcher.
What we're doing with naloxone is simply trying to save lives of people who overdose.
Experts estimate about 33,000 doses of naloxone will need to be distributed each year locally to get this crisis under control. Another tool that's up for consideration, fentanyl strips, so users can test their drugs for fentanyl before using.
What would your response be, though, to critics who may say we're just enabling people to continue to use drugs?
Yeah, but I mean, the same would be true if you had a diabetic who didn't monitor their insulin level properly and they went into diabetic shock, and we said, well, we're just going to let you die because you should have better monitored your insulin. We don't do that. We don't turn away someone from the emergency room because they didn't take care of their health and they were overweight, and say, well, you made a bad choice, so we're not going to treat your heart condition.
Though the use of pure fentanyl is becoming more popular, the DEA says many of the overdose deaths are happening to people who have no idea they're even taking it. Users often think they're taking a drug like oxycodone or cocaine. Instead, it's laced with fentanyl.
This is one pill can kill. You get one shot at this and it's over.
Sadly, teenagers are among those who fall victim. Last May, a 15-year-old Coronado High School student died of a fentanyl overdose.
Do you think that naloxone should be available in schools?
I think naloxone should be available everywhere.
CBS 8 checked with local school districts to find out if they have naloxone on hand at their schools in case of an overdose. These were the only districts on this list who responded yes.
You guys did launch a public awareness campaign, the One Pill Can Kill campaign, and yet this still keeps happening. Why isn't the public getting the message?
I think it's education. We have to continue to educate the people here. These are things that we have to make the parents aware of.
And that includes, she says, the fact that you can buy drugs on social media platforms like Instagram and TikTok using emojis.
As your kid sits next to you on the couch and they're ordering something with emojis and you're none the wiser.
The DEA posted a chart online showing what each of the emojis stands for when it comes to drugs. Special Agent in charge Howe says though they've seized enough fentanyl for every American to have a lethal dose, the drugs continue flowing into the U.S. from Mexico.
You put your finger in the dam to try to stop the water coming in and it's overflowing on top of you. It's defeating, yes, but it's not going to make us quit. It makes us work harder.
Experts say there are myths that fentanyl users are seeking a high every time they use. But Dr. Luke Bergman says some users are using it just to function.
They're seeking it out just to stay well because of the sort of cycle of tolerance and withdrawal that we see with opioid use.
He acknowledges the healthcare industry bears some responsibility for this crisis. Users sometimes turn to illicit drugs because they can't get prescriptions from their doctor. He says the idea naloxone will just give users the green light to keep using is false.
So there's actually really good research that demonstrates that communities that lean into distributing naloxone are not increasing drug use. And I understand, of course, that that's a kind of common misconception about naloxone distribution and about harm reduction approaches generally, that they're facilitating drug use, that more people will engage in drug use in the context where harm reduction work is happening. It's actually not true.
Erin says the grip fentanyl had on her was so powerful that just hours after she nearly died taking the drug, she still thought about using.
And this is how sickening this drug is.
She's been sober now 4 months.
Do you think you'll ever go back to it?
I can't say yes and I can't say no. You know, I want to say, no, I will never, never, never go back to that. But when I had 3 years clean, I said I will never use fentanyl, and I did.
It's really not until they're ready. You can want it for them all you want, but it's not till they hit rock bottom.
Today, I live in a just for today mindset. Just for today, I will not pick up. Just for today, I will not drink. Just for today, I will not use drugs. And if I can do that every single day for as long as I live, then I should be okay.
In Carlsbad, Kelly Hessedal, CBS 8.